We probably could have a sustained flow of fuel for the coming year to come, etc. When you offset it against the cost against these airdrops. So these airdrops are definitely in the Gaza situation extremely cost ineffective. They're occasionally dangerous. People have been killed. We also have seen, at least I've seen it in my own eyes with the former airdrops, I didn't see it this time, that sometimes medical supplies are included, which can be very dangerous because they are just dropping everywhere and they are not like collected or somewhere and then they go to an hospital, etc. I remember in this first range of airdrops, we even saw some sachets with morphine we identified. So in short, well-intended, not needed in Gaza. There's a system there, there's a system in place, and I really would back, invest those funds in a proper humanitarian approach, etc. UN and partners are very much ready for that. Over to you.
Absolutely. As we heard this morning from Tom Fletcher, we are ready to go, and we should let be in at this point in time and very strongly. I'll go now to Emma Farge, our correspondent of Reuters.
Good morning. Question for WFP and for WHO. I'm wondering whether the first steps in the Gaza City military operation are already making aid flows more difficult, either into Gaza or within Gaza. Are there extra impediments because of this campaign? And for Dr. Pieperkorn, please, I'm wondering how famine is affecting other patients, trauma patients in hospitals who will need a certain amount of calories to recover. Can you tell me how other patients are being affected by starvation? Thank you.
Absolutely. Okay, Jean-Martin, you want to start with the first question?
Okay. What we've seen in the past few weeks in Gaza City has been an exponential increase in child malnutrition and acute malnutrition. This is a very worrying situation, and it's one of the reasons why we're now talking about a famine in Gaza City. The data is there and shows how urgent it is to devote specific attention to the children in Gaza City. And the worry is that along this path, the numbers could get worse. I told you that the acute malnutrition in Gaza City has tripled since between May and July. And because it is a geometric increase, we could have a doubling very quickly. This needs to end right now because of its very real impacts on many children in that part of the Gaza Strip.
Thank you. Enrique, maybe on the second question?
Yeah, let me add, and also a little bit on the first one. So what we of course see happening in the north of Gaza, and this increased hostilities which are already going on, and then I think I would say almost the mass casualties incidents surrounding any food distribution. We see this huge increase in trauma and trauma patients, and what I reported on, and just to give some figures, situations escalated sharply in July with daily fatalities of an averaging 119, so nearly double the average recorded in May. So as if we were back in the first 6 to 8 months of this conflict. Injuries also surged dramatically with nearly 14,000 in July compared to 6,000 in May, and a reflection of that you see in we see actually in this we see that in all the hospitals this completely that all those hospitals have become massive trauma wards. I just want to say something about malnutrition because we get this question as well. So how do we then support malnutrition? And then we'll address the question how it impacts. So as we all know, that malnutrition can be a direct cause of death or a contributing factor, and that often weakens the immune system, making the body more vulnerable to infectious and other diseases. And And as such, malnutrition may be the primary cause of death or the cofactor, and increases the risk of mortality and conditions. So we are supporting actually the hospitals, the Ministry of Health in verifying malnutrition-related deaths and using agreed technical guidelines. Special committees are formed at each hospital. This committee review all non-trauma deaths from the previous 24 hours and check if malnutrition may have been a factor. And to do this, they assess such as the MITS, upper arm, circumference, weight for height, etc., body mass index, etc., and any recent signs of severe weight loss and other diseases, underlying conditions. And the criteria are adapted for each age group. So, and the death report from WHO or by the Nutrition Stabilization Center are also reviewed together with those committees on the same criteria. Now, the question, so why do I want to be clear on this one? Of course, the generalized malnutrition, which you see everywhere, impacts everything. So we see, for example, and having witnessed so many trauma patients and talking to the medical specialists and surgeons, etc., recovery takes way more time for every patient, and people don't recover. Recovery from wound infections, etc., takes way more time. All of those things are related to the, I would say, to the almost generalized malnourished state of so many people in Gaza. And I think and you see that in the IPC report, rightly so, there's always a focus on under five children, because they are the vulnerable group, small children. But the IPC report, and we've pointed this out as well many times, also points out they are deeply concerned about, let's say, the older children, adolescents, and the elderly. Not just trauma-related, let's say, injuries that people recover, the recovery time takes way longer or it doesn't happen, but also elderly and other people suffering from non-communicable diseases, etc. So if you are in we all know, a better physical state and at least well-nourished, etc., the whole, even your medication, etc., makes a much better impact. So yeah, it's a huge impact on every health-related condition. Over to you.
Thank you very much, Rick, and thanks to Jean-Martin. I'll go now to Gabriela Sotomayor, our correspondent of Proceso.
Thank you, Alessandra. 2 questions, if may I. So this is a famine that has been predicted for a long time. Why are you announcing it now? What's changed? And the second question regarding accountability. I'd like to ask you, it's obvious that Mr. Netanyahu is responsible, but so are the complicit governments that have supported him. Is that correct? You more than anyone are witness of what is happening. So can you indict Mr. Netanyahu in an international court? Do you recommend a court like others established in the past, like International Criminal Court of Rwanda, for example? Thank you so much.
Thank you, Gabriela. So I'll ask maybe Jean-Martin to answer your first question. I think he did actually explain, but maybe you want to reiterate this for our journalists. And Jeremy will take your second question. Jean-Martin.
Absolutely. What I'd like to emphasize here is that there have been many warnings of a risk of famine in Gaza from the IPC and the Famine Review Committee. Those warnings began in late 2023, and the last time we were here together to discuss the IPC process for Gaza, it was on July 29th when there was an alert issued. So there have been many, many warnings along the way. I need to emphasize that the IPC is a 21 agency partnership. It includes intergovernmental organizations, UN agencies, NGOs. It's a very robust process that has been ringing the alarm. So the question is, why now? Well, as the last time we spoke in July 29th was the moment when in Gaza City we saw indicators breach famine thresholds. That has been the case for food consumption. It's been the case for malnutrition. And what's happened since is that the experts have worked on the data for the entire Gaza Strip. They've looked at updated information also in the case of mortality, and that allowed a famine determination to be made and confirmed by the Famine Review Committee. So this is a process that's very meticulous, it's very precise, and that reached its conclusion just a few days ago, and this is why we're coming out today with this confirmation of a famine in Gaza City.
Thank you very much, Jeremy.
Yes, thanks, Gabriella. There are two ways, two parts to this question. First and foremost, as the High Commissioner said, it is Israel's responsibility to open the borders and to ensure aid flows in at massive levels immediately. As he says, it's a war crime to use starvation as a method of warfare, and the resulting deaths may amount to the war crime of willful killing. I'd also like to point out on, with respect to third parties, because I think you raise an interesting point, and it goes to what other journalists raised earlier. And when we talk about international humanitarian law, which is, and specifically the Geneva Conventions, which are the cornerstone of international humanitarian law. And it states, Article 1 of the Geneva Convention states that all contracting parties must undertake to respect and ensure respect for the Convention in all circumstances. All states have an obligation to prevent a violation that may be committed. The greater the degree of influence, the more measures a state is obligated to take. It's quite clear.
It is quite clear, and also refer to the statement of the Secretary General, Gabriela. Oh, I see you have a follow-up. Then I'll go to ARD and FA.
Thank you very much. So the cruelty of this punishment, I am not a doctor, but how long a person has to suffer from hunger to die? I mean, how many days? The cruelty is it's really, I don't know how to describe in English, but it's beyond measure. Can you say something about this process of a person to die without food and water?
Yeah, maybe I will ask Rick to take this one.
Yeah, I find it a difficult question, and also, you know, maybe I don't want to go into this discussion of cruelty and everything related to that. It should just simply not happen. And I think, as has been mentioned, we're talking about a man-made malnutrition crisis. And I think so men can also fix this. I also want to stress it's very difficult because I think I just referred to that earlier, that malnutrition can be a direct cause of death or contributing factor, and it often directly, of course, weakens the immune system, and it makes the body more vulnerable to infectious and other diseases. We see this incredible poor water sanitation conditions all over Gaza, and already from the start of the crisis, and vastly deteriorating, which are all cofactors. So it's sometimes difficult to also say, is this malnutrition the primary cause, or is it definitely a cofactor? So we, in short term, in days or weeks, we see weight loss and muscle wasting, fatigue, weakened immunity, etc. What I said, and then we get when it takes a little longer, you just talk about micronutrient deficiencies, which cause anemia, poor wound healing, which I already referred to, which is every time you go to these trauma wards, etc., the doctors there and nurses, etc., tell me that something like how incredibly long term, and then with all the risks of this multiple and this multi-drug resistance, of course, which is increasing as well, and higher risk of infection of anything, and on the long term, and that is, I think, we even don't think about enough that when you talk about long-term stunting, and for children, you can talk about organ damage and delayed development, and of course in severe cases also death. For young children, can happen very quickly, as we know, in a few days without and weeks without adequate feeding because they have a high nutrient needs, etc. Adults, especially elderly, etc., the visible signs can take longer, but I think it's not for nothing that also the IPC report points out, hey, this is so generalized, and yeah, we focus on children under 5 as a special vulnerable groups. But please also take care of the older children and the elderly. And I see, by the way, also around me and even among my own teams and staff, etc. In general, there's much more of almost a lethargy. People not only are exhausted, etc., but hardly anyone gets proper, diverse food. And that is even for the ones, humanitarian workers we work with. So let me leave it here. Over to you.
Thank you very much, Rick. We feel despair. Let me go to ARD, Tobias Haller.
Yes, thank you. I am asking the question. I'm Mara Probst. I'm also from the ARD German TV and Radio. I'm asking the question for Mr. Haller.
Please.
Thank you. I have a question also for the WFP or the WHO, we've heard it before that there are certain factors that led to the declaration, and we heard that mortality was one of the factors. Could you please elaborate again, maybe, or emphasize on which factors you kind of based this declaration and what made it phase 5? What were the essential factors? And also, what will be the direct consequences of this declaration? What will be the consequences for Israel? What will have to be done? And also, whether this phase 5 is set for all of Gaza, so like 100% of the population, or how much percent of the population is affected? Thank you.
Thank you. Again, I think Jean-Martin had spoken about that, but I'll give him the floor again, maybe to just underline these few points. And Rick, if you want to add something afterwards.
Okay, well, look, what this new IPC analysis tells us is that there is a famine in Gaza City, but IPC 5 conditions also cover other areas. And there's a distinction between famine and IPC 5. Let me explain that quickly. The IPC is a 5-point scale. Phase 1 is a normal, 2 is stress, 3 is emergency. 3 is crisis, 4 is emergency, and 5 is a catastrophe. When you've got enough people in phase 5 and there's a review by the FRC, then that can be confirmed as a famine. So phase 5 and famine are two things that are related but not exactly the same. So what we say in this release that came out just recently is that there is a famine that's confirmed in Gaza City, but the phase 5 conditions are now affecting 500,000 people and up to 630,000 in between now and the end of September. Now, in terms of mortality, what the report says is that, and this was looked at by the FRC, who include experts in the areas of food security and nutrition and the study of mortality. They tell us that mortality is usually underreported in Gaza, especially for non-trauma deaths. And that's because of the breakdown of the information systems in place. So the health systems is now experiencing a surge in illness and things like multi-drug resistant infections. That makes treatable injuries increasingly fatal. Newborns face elevated mortality risks as well because there's been a collapse in neonatal intensive care. And there's a convergence of widespread malnutrition, illness, and collapsing health systems, deteriorating wash conditions. Water and sanitation is very problematic, and increase in child diseases, in addition to a very worrying increase in acute malnutrition. All that led to the consideration that Governor at Gaza City reached a famine level mortality.
Rick, you want to add something?
Yeah, maybe a little bit. I think Jean-Martin, raised all, and I think and you can find this, by the way, in the IPC report. So, I mean, for classifying famine, it means that that's the most extreme category, and it's triggered when 3 critical thresholds are met. So extreme food deprivation, acute malnutrition, and starvation-related deaths, and they have been breached. And the latest analysis now affirms, on the basis of reasonable evidence, that these criteria have been met. I mean, like for the Gaza governorate, and maybe to add there, because you asked a bit. So you talked about 500,000 people facing catastrophic conditions characterized by starvation, destitution, and death. But another over 1 million people, 54% of the entire population, are facing emergency IPC phase 4. And close to 400,000 people, 20%, are in crisis, what is called IPC 3. And maybe to say one more thing, if nothing would be done now, and the report also is clear on that, then it's projected, not just if you look at acute malnutrition of children, which is that really exponentially increasing, but it's also over the longer term, if very little happens, that it's projected that through June 26, part of the report, at least 132,000 children under the age of 5 are at risk of death from acute malnutrition, according to this IPC analysis. And also this number has doubled compared to the IPC estimates reported in May 25. Over to you.
Thank you, Rick. And this figure are really appalling. And so let me go to the last questions from Isabel Sacco, the Spanish news agency.
Yes, good morning. Thank you very much. There is already a reaction by Israel to the report, and I would like to read to the representative of IPC what Israel says, denying all the main result of the report about famine. So Israel says, the IPC twisted its own rules and ignored its own criteria just to produce false accusations against Israel. The IPC changed its own global standard, cutting to 30% threshold to 15% for this report only, and totally ignoring its second criteria of death rate, solely to serve Hamas fake campaign. Thank you for your response.
Maybe, Jean-Martin, I think you had spoken about some of the criteria. Maybe you want to answer our journalist.
Sure. So what I'd like to say is that, again, the IPC is the gold standard for food security analysis worldwide. The indicators we used in Gaza that the IPC used, and I'm not the IPC representative, I'm the WFP Director of Food Security Analysis, but the indicators that the IPC used for this analysis have been used in other countries. I told you earlier on that there have been famine determinations in the past in Somalia, South Sudan, Sudan. We used the nutrition measure used in Gaza in the past as well. I think what I've heard as an objection is that we used the mid-upper arm circumference as a measure for malnutrition instead of weight for height. That's something that is allowed for in the IPC protocol and has been allowed for by the IPC manual since 2019. And this measure that we used in Gaza for the determination was also used in past famine declarations in South Sudan and in Sudan. So the protocols have been applied in the case of Gaza. And I remind you that the IPC also has a strong governance mechanism that includes a famine review committee with the foremost experts in food security and nutrition and mortality that looked at the data. And we can take this finding as seriously because this is the gold standard in food security analysis worldwide.
Thank you very much, Marta. And I see Rick wants to add something.
Well, it's difficult to add something. I think Jean-Martin has been very clear, not just the gold standard, but it's also a very well established global system. So I think it should be taken seriously, very, very seriously. And it's factual. I also want to remind that everyone who's working here on the ground, and anyone, for us, WHO, I heard it from my UNICEF colleagues and many other NGOs and colleagues, etc. We see this happening on the ground, and we have been warning constantly on this. So is it a surprise for us? No, it's not a surprise. And this is so, like overwhelming when you see this, not just in the hospitals, etc., within the communities, etc. I also want to make the point that we have had previous debates on, on mortality rates and the number of people killed and injured, etc. And like we have raised before, I think every one of us tries to be as factual and analytical as possible. And I'm afraid we're talking about underestimation in many of these topics. So maybe that's all what I want to add to this.
Yeah, indeed. And Jeremy, you want to also add?
Yeah, I'd just like to add one thing, well, a couple of things actually with respect to this, and just echoing what my colleague's saying there. The first is we are witnessing people starving to death already, beyond what this report is saying. That is beyond doubt. The second thing is this: we have been talking about flagging warning about this nightmare scenario, which is going to present itself through the declaration of famine. Now, so now we're at the stage where this nightmare scenario is reality. It's horrible, cruel, unforgivable reality. What's happening on the ground, as stated in the declaration. And the other thing is, I just reflect on the fact we've talked about our office on the stain of a stain on humanity when it comes to events that have been unfolding in Gaza. Maybe today we need to reflect on the fact that inhumanity, our collective inhumanity.
Maybe,
yeah, and
Alexandra,
yeah,
can I maybe add,
sure, Rick.
add one thing? Also the IPC over the years, etc. What I understand, it is definitely not the IPC experts. I'm not speaking, but it's not just the UN. It's 21 organizations, including respected NGOs, with long experience in dealing with hunger, malnutrition, and its effects. Yeah, and this kind of questioning and arguing about the reports, it makes me incredibly sad. We got to do something about that. Please, can we please do something about this? Can we please, make sure that this is reversed and this never happens again? Can we please work on that? I think these petty discussions about arguments, about data, etc. There's a massive disaster going on. We can all witness it. We can all see it. Can we please help solve this? Thank you.
Absolutely. This is indeed a humanitarian catastrophe of epic proportion. And as we've been saying the whole morning, famine must be stopped at all costs. And this is a race against time. To end this this terrible situation with an immediate ceasefire and humanitarian response at a very large scale, unimpeded, that will save a life. Gabriela, sorry, let me go to Christian, because she's not asked any question. Then if we have time, I'll go back to you. Christian, Rick is our correspondent of the German news agency.
Thank you, Alexandra. And I'm sorry, Rick, I totally agree with you, but because this information is out there, we do have to follow it and verify what the facts are. We report all the time that there's this 30% threshold on, let me just read it properly, on children that suffer from malnutrition, and the Israelis are saying in this particular report, it's only 15%. I haven't found that immediately, but to refute that claim, it would be good to have a confirmation that no, the three criteria, 20% of households, 30% of children, and so many people dying per 10,000. It would be great to have a confirmation that all three, including the 30% of children with malnutrition, could be confirmed. Thank you.
Thank you. Jean-Martin?
Thank you, Christian. I'd like to help with that. There are different ways of measuring malnutrition. One of them is weight for height. And that's when, if measured by weight for height, so that's you measure how tall the child is and you weigh the child. When you get 30% above the malnutrition as assessed by weight for height, that's where you're in famine territory. Now, the IPC manual also provides for using MUAC, which is mid-upper arm circumference. You measure the upper arm of the child with a tape. Both are acceptable measures, but they're very different measures. And the equivalent to 30% in weight for height is 15% by MUAC. That's been established, again, by the nutrition community, by the experts who are part of the IPC and even outside the IPC. What happened in Gaza City is that the threshold of 15% MUAC, mid-upper arm circumference, has been exceeded. The incidence of acute malnutrition by the MUAC in Gaza City has tripled between May and July. The use of the MUAC as a measure for the IPC has been accepted for years now and has been used in past famine confirmations as well. So I hope that reassures you. All that information, it's very technical, is available online if you want to double check as well. We're also happy to take further questions if we want to get into the details of that.
Yeah, thank you very much. And yeah, as one of our colleagues here is saying, I mean, that would be a simple solution to verify all this, Christian, and that would be to let international media in to verify and to see by themselves. But I think Jean-Martin has been giving you the scientific answer, and I thank him very much for this. Rick, I see your hand moving. Is that
no?
You want to?
Sorry,
no,
no,
okay. No worries. Thank you. It's hard to see from here. Gabriela, very last question. Also on Gaza, I understand.
Yes, thank you so much, Alessandra. My question is, was oxycodone drug found in flour bags distributed by Israel in 8 centers? And if it's true, because I was on vacation, I don't know if you already talked about this, but I understand that oxycodone drug, it's a serious thing. I don't know what are the main effects of this drug, if you have any evidence on that. Thank you so much.
Rick.
Yeah, I heard, I think we heard the rumors. I wouldn't know at all. There's no confirmation of that at all. So that's all what I can say. We don't know.
Thank you. That is very clear. So I'd like to thank all the